it works pretty well as long as you don't need it. Okay, it's just when you need to use it that it's not there for you. And there are three classes of people that are exempt from the Canadian healthcare system. Politicians, the three P's: politicians, prisoners, and professional athletes. Okay, they can get private health care. Canada is one of two true single-payer systems in the world. Now, what true single-payer means is that the government is the only payer. There's no co-pays, there's no deductible, there's no out-of-pocket. As a matter of fact, it's illegal for a doctor to accept cash from a patient, with the exception of Quebec, where Dr. Shaoli changed, the system. But a doctor cannot accept cash, so you can't go to a doctor and say, "Look, hey, I'll pay for it." You can't do that. The other country, by the way, that has true single-payer healthcare is North Korea. Okay, so those are the two countries. Now, ironically enough, I still have a lot of clients in Canada when I go back there. The last time I was in Calgary, Calgary's booming. They are now calling us their socialist neighbors to the south. Okay, so it's starting to come around. Universal health care is impossible. It is impossible, because what it promises is that everybody is entitled to the exact same amount of health care. Now, that doesn't work, because a 23-year-old athlete needs less health care than a 70-year-old diabetic overweight smoker. That's just a fact, okay? But the young ones resent it. They resent that the old people are taking what they're entitled to. And an example that happened to my mother. Her friend, my mother's friend, was diagnosed after 2 years with stage 4 inflammatory breast cancer. She had rashes on her chest, and she went to the doctor, and she was told, "Oh, it was just spider bites." And then she, it was red, and she was told, "That's just poison ivy." They just said, when she went to the government clinic, they just sent her away. And she was one of the insured people, not the uninsured. They just kept sending her away. Finally, my mother dragged her in, and she said, "I'm not leaving until my friend gets a diagnosis." And they, ultimately they did a biopsy, stage 4 breast cancer. So my mother's other friend was at the government liquor store getting her daily 2 cans of beer, and she was looking really down. So the clerk said, "What's wrong, Mona?" And she said, "Well, my friend, who's only 78, was just diagnosed with breast cancer. She's got about 2 to 4 weeks to live. And I'm 84. I couldn't even imagine what would happen if it happened to me." Somebody behind her in the lineup said, "Lady, if you're 84, you want to be dead instead of costing the rest of us money." Okay? That is what socialized medicine does. It causes that resentment, person against person. Okay? That's what it does. There's many other reasons why it doesn't work. Okay? But those are the main reasons. Now, Canada is moving in the correct direction. They're actually privatizing more and more. There's 2 provinces now where they allow people to get an MRI and pay for it and a CT scan. They didn't used to do that. So they're moving in the right direction slowly, while we're moving in the wrong direction. There's many things which happen to healthcare, and I wrote a book, and I only have, I think, 8 or 9 of these left. I'm actually back ordered by 200 copies because the entire Texas legislature bought a copy, Tennessee bought a copy, all the senators and reps. West Virginia has some on order, Arizona has some on order, so I'm writing a 2nd edition. So I do have a few left if anybody wants. They're $10. I talk about this, and let me tell you why I called it Medicrats. I studied Latin in school for 7 years, and I hear, the medical bureaucrats and bean counters, and I hear autocrats, aristocrats, bureaucrats, and I'm thinking, what's all this crap? Okay, so I looked in my Latin English dictionary, and it comes from the root word kratia, which means to rule, or the Greek kratos for strength. So medicrats are the medical rulers who want to regulate our health. Okay, I talk about the history of healthcare, what happened in 1798 with the Disabled Seamen Act and 1836, and I go through, a couple of Supreme Court rulings, and when Blue Cross was invented by the American Hospital Association and Blue Shield was invented by doctors in 29 and 39 respectively. But there's a few things that happened to healthcare that were monumentally bad. One of them was in 1944, of course, there was a wage freeze, okay, during the war. You couldn't increase wages, so employers started offering health benefits to be competitive. Then in 1954, the IRS made it tax deductible. From that day on, if you wanted to give somebody a $100 raise, today, it probably costs you about $125 once you add the Medicare tax, the Social Security tax, workers' comp, okay? It costs you $125 once the employee receives it, they pay their share, and the income tax, they get $65. So it costs about $125 to get $65 clear. In healthcare, it costs $1 for $1 because it's tax deductible. Since 1954, if you graph it, you'll see that healthcare has grown at twice the speed of wage inflation because it costs half the money, okay? So that's one of the big reasons. The other thing that happened, and I won't even talk about Medicare because that's kind of obvious, but in 1973, the passage of the HMO Act, that was monumental because prior to 1973, and I see a lot of people in the audience are old enough to have turned on a high beam with their left foot, okay? So you'll probably remember back when the product that we purchased was medical care, okay? We went to our doctor and we said, hey doc, my knee hurts. And the question wasn't, well, who's your coverage through? You know, or what am I covered for? Which is the conversation now. You know, my knee hurts. And you purchased the medical care that you needed. The doctor told you how much it was, not a third-party payer, and you paid it. Today, the product is health care. Okay? What does that mean? When they have health care reform, what are they talking about? Are they talking about reforming doctors? No, the health care really means the payment system. It's just like we buy cars. It used to be that we went to the car lot and it said $8,600 on the window, and we knew the options were the expensive part. The electric windows, the radio, the 8-track, like the options were the expensive part, so we stayed away from those. Today, when you buy a car, it says 0 down, $499 a month. And it's got electric windows, it's got electric lot, it's got a stair, I mean, it's all built in. So they disguise the true cost of the asset by putting it on monthly payments. Healthcare is exactly the same. So now what we're finding out with, number one, with Obamacare, there's what is called an 80% medical loss ratio. What that means is when you buy a health plan through Blue Cross or whatever, they have to spend 80 cents out of every dollar on medical care. And at first everybody thought, well, that's great, that's a good thing. More should go to the doctors, you know, less should go to the CEO of the insurance companies. That's what people said. It has the exact opposite effect, okay? Number one, you know you're losing 20% of your dollar right away. But if the insurance companies are only allowed 20% overhead, which includes premium tax and profit and service and claims adjudication and all that other stuff, if they're only allowed 20%, if the average policy costs $500, 20% is $100. That's what it costs to administer it. If they took steps to reduce the premium, like by increasing deductibles and copays and stuff, to $250, it's still going to cost $100 to administer. But now, the medical loss ratio is not working, so they have to keep the premiums up, okay? The other thing about changing the product, actual medical care has become a byproduct, almost a necessary evil of healthcare. Now, how many people in this audience run a business that produces a product or service? Does anybody, what do you do?
We clean sewers.
Okay, you clean sewers. Is there anybody else that is in a similar business where you have a cleaning service, where you provide a service? Okay, other people have businesses. If the government said to you, you can only charge $100, okay, and that's it. And anybody can do it, and they're only going to get $100. And if that was too low, you might be a lot better and quicker. Why shouldn't you be entitled to charge more?
I agree.
Right? Exactly. So the government says everybody needs to be paid the same amount. Okay? I think a doctor that is board certified, that maybe had a high-end residency and fellowship, should be entitled to charge more because they have better outcomes and quality. Doctors are practically prohibited from competing. Competition is practically prohibited among medical care. Once you take away competition, what happens to prices? Okay? Competition is what keeps prices down. When businesses buy things, whether they're computer systems, whether they're security systems, whether they're desks, they usually shop around a little bit. They check with a few people and they tender it out. Medical care isn't purchased that way. It's based on price fixing. Okay? So what... It doesn't like my book. So what are the solutions? Well, there's a lot of solutions, but before we get into that, I'll talk about the exchanges a little bit. There's a lot of misunderstanding on the Obamacare exchanges. First of all, fact number one, there is only one exchange. It's one national exchange. The states, the legislation wanted all of the states to set up their own portal to the master exchange. And there was some seed money that was in there. We'll pay for your first year of operations if you set it up. Okay? After that, you're on your own. And what happened was some states says, well, you know, we're kind of not too sure. Because what they discovered is when you set up an exchange, you have to sell compliant plans. Okay? And compliant plans have to cover things that some states and some people find objectionable. The Catholic Church finds coverage of contraception and abortion objectionable.